Hey all, it is Dr. Tasha Rogers and I am back. We're going to have some fun today, okay? So I want to talk a little bit about the weather is starting to break. At least it's starting to break here in Atlanta. I know y'all up the north, honey, be blessed. All y'all, wherever it's cold, good luck with that, okay? But it's starting to break here in Atlanta, and as that starts to happen, honey, people get to come outside with shorts on and 60-degree weather. It just reminds me that it is about to be spring and folk are about to come outside. Now, everybody is not up on the lingo, okay? So if you understand what I mean by outside, be patient. Let me talk to the people in the middle and the back of the classroom, girls, okay? While we get this language thing together. So first of all, this video is for males, females, and anybody in between, okay? Betwixt, between, whatever. And we're going to get into what outside means. In the meantime and in between time, go ahead. Don't be scared. I'll wait. I'll hold on, sis. Freeze the video and go ahead and like it because y'all be forgetting to like the video. And I want you to hear the message. You hear the message, then go ahead and share it with whoever you feel like it needs to get shared with, point blank and period. Now, when we talk about outside, that is like kind of new slang for meaning we're on the dating scene. We're on the scene again. And that means that we're looking for stuff, and be it a relationship, be it a sexual relationship, be it a jump off, be it multiple situations. Outside is kind of, for me, what I liken it to with my patients, with my friends, anybody. I'm in the space right now to do whatever I want to do, judgment free. How about that? And I feel like that too. I feel like life should be judgment free in general. But when it comes to being outside, generally that's going to be talking about your dating life and your sexual life. So I think that it's very important we get into that and what does that mean. Everybody's at different phases in their life. You know, I have people who are young and they're like footloose and fancy free, and they're like, Doc, I have my medicine ready when I get back because I'm going to Miami and I'm gonna do what I do. And it is what it is. Girl, have a good time. See you when you get back. I have people who are, you know, their kids are leaving for college. They didn't want to date while their kids were at home. Their kids are leaving for college. They're empty nesters, honey. They're ready to get outside. People who are newly divorced or in a healthy space after their divorce. Now they're ready to get outside. You got your little, you always gonna have your cheaters, but again, we don't judge them. We're going to help them too. And they ready to come outside. Single people are finally like, I'm ready to date. I'm ready to come outside. Okay. Widows, any and everybody. So if you out and you are ready to come out, ready to be a part of something new, even if you're, adopting a new lifestyle. Some people are going kind of getting into the polyamory thing, or, you know, the mixed couple thing. What is what it is. There's no judgment here. I'm just going to teach you how to do it carefree, stress-free, and risk-free. How about that? So if you fit into any of these categories, if you know somebody who fits into any of these categories, let's talk, y'all. All right. Now, the most important thing about being outside or knowing somebody that's outside is just, I guess, to not judge. Mind your business. What they're doing is what they're doing. It may not be what you would do, but that's not the point. Like, we have to learn how to, you know, shake our head, listen, not judge, and offer up what somebody asks us. Sometimes people just want to talk. They don't want your opinion. They did not ask your opinion. If you go back in the conversation before you start giving your opinion, why don't you just kind of double down and see if somebody actually asked, or if they're just venting to you, confiding in you, or whatever the case may be. They're just looking for a place of comfort. They may not actually want your damn opinion. Just saying. So, you know, when somebody's outside or they're expressing their relationships, or you're outside, just be very mindful to do a lot of listening and not a lot of talking. Okay? Because sometimes when we feel judged, we'll shut down completely, and there may have been something that your friend needed to share with you, or your friend wanted to share with you but was unable to because they felt judged. So let's not do that, okay? So that's very, very important. No matter who you are, no matter what the situation is, walk into that thing confidently. You have to answer for you. It's it's like, what do they say? Like drinking poison and then the other person dying. That's not how that works. So you have to be responsible for every single thing that you do, not the other person you're in a situationship with, relationship with, whatever you want to call it. Not the person who you're confiding in, not your mama, not your friend, none of that. You are responsible for your own actions. So don't let anybody shame you. Don't let anybody judge you. Do what you do and do it confidently, okay? Now, the first thing I want to talk about is what to do before you actually embark in a sexual relationship with anybody. I don't care if it's what kind of relationship it is. If it is a sexual relationship, the first thing I want y'all to do, even before anything, any physical thing, the first thing I want you to do is like some of y'all text, some of y'all message, I don't know, however you communicate, kind of get a feel for where that person is with their testing. Be like, so do you go get tested for STDs, HIV? Do you go get tested on a regular basis? Now, I can guarantee you that 9 out of 10 people are going to say yes. I can guarantee you that 1 out of 10 people actually get tested. Okay, so here's what you're going to do. You're going to bring it up in casual conversation like, yeah, because I don't play about me. I don't play about me. You can't touch me unless I know you good. Like, we not doing that. Like, I'm not doing that. I'm going to let you know I'm good, and I want to know that you're good. Oh, no, I'm good. Oh, okay, cool. So you got paperwork? You got testing? Because I'm going to have my paperwork. So you have your paperwork together? If somebody's like, well, no, I know I'm clean. No. Okay, the first victimization, the first mistake that you're going to make is having sex with somebody without seeing their STD testing. Please do not do it. Don't put yourself in that situation. Don't even be like, well, we ain't even plan on smashing. No, you planned on it. You didn't want to admit to planning on it, but low key in your mind, you planned on it. If you don't know what somebody has, don't let them touch you. That's just like sitting on a public toilet with sitting on a public toilet, period. But sometimes I do not know, and you gotta put the little paper down. But it's like sitting on a public toilet with no paper and nothing down, and you're just sitting with your bare booty. Like, would you ever do that? So that's what it's like letting somebody touch you and you don't know what they have. And it don't look a certain way, trust me. Like, don't even think that it looks a certain way. Okay, so that is the first thing. Like, you want to see their testing. You don't want to hear about it. You don't want no IOUs, none of all of that. Somebody owe you money, you want your bread. You don't want to hear about how they might get some money, next week and they're going to take care. You don't want to hear all that. Run me my money. Exactly. So same thing. Be like, listen, boy, girl, in between, whatever. Run me some test results. Just run me some test results, because everything is above board. One thing that I always try to definitely instill in my patients is that testing is not about trust. Testing is not about trust. If this is somebody who you want to be with, you are with, situationship, relationship, whatever, I'm sure you do trust them. Like, I'm sure they're trustworthy. I tell people all the time, I'm sure your husband is trustworthy. Like, at the end of the day, you're with him. Who's to say that he's not trustworthy? But what he is human. And when we're human, we are succumb to life's circumstances. Okay, let me give y'all, we got a little time in this video, so let me give y'all what I break down in my office as far as males and females, because I want everybody to have both sides of the fence. So let's say you in your little relationship, you tucked away, you happy, you ain't at the club with your girlfriends, right? But it's somebody's birthday. So like, girl, you never come out. Come on out to the club. So you're like, all right. So you tell your boyfriend, all right, we going out for Keisha's birthday on Friday. Okay, well, go ahead on. Have a good time. You need some money, all the stuff. So you dress, you ready, you out with your girls. Y'all in line at the club, and you get in the club. I guess they still do lines. Child, I ain't been in the club in about 15 years. Maybe longer than that. But anyway, so you in the club. So you hear across the room, Keisha. So it's somebody who you knew from high school. He plays for one of the professional sports teams, right? So now all of a sudden, yes, this is an elaborate story, but it's going somewhere. So now all of a sudden, he like, come, you and your girls, come to my section. So y'all go to his section. Y'all talking, y'all drinking, it's free. Your girl's like, oh, you know him, girl. This is a good birthday. Okay, great. So now he like, no, let's go in the back. Let's have a conversation. So now y'all in the back of the club in his G-Wagon, right? His little security standing there. Y'all in the back of the club in his G-Wagon. and all of a sudden y'all having a conversation, this, that, and the third. He might even be like, here, take this, go buy yourself a new bag, go get something nice for yourself, whatever. Okay, he goes down on you. Boom, he comes up, puts it in. Before you even like, what happened? Boom, it's over, it's done. Now you taking a walk of shame back into the club. So you came out of Proverbs 31, woman. You don't mean nobody no harm. It don't mean you not a good woman. It does not mean you not trustworthy, but you're walking back in the club sexy red. You see what I mean? And now you just had unprotected sex with somebody kind of before everything just kind of unraveled before your eyes, before it even happened. And now you got to go back home to this man. You see how life happens? It don't mean you're not trustworthy. Even for him. He could be at work working an overtime shift, trying to get some extra money because you said you wanted a particular bag, shoe, vacation, whatever. And so, you know, it's always going to be a thought somewhere. I mean, they just everywhere. We love them, but they everywhere. And, you know, she like, well, you know, I used to get awards for my blowjobs in college. Oh, okay, yeah. He might not even know her name. He might not be thinking about this girl. He might not even know her name. But she might be like, you want to go in the bathroom? You want to see? Well, I can promise you that not 10 out of 10 men going to say something, but about 7 to 8, 9 out of 10 might be like, I mean, okay. So they go in the bathroom. She do what she do. You know, she lift up her skirt. And it's an opportunity. It's a moment. He don't even know this girl's name. He ain't think about you. He ain't think about disrespecting you. He ain't think about the love. He's thinking he's in the moment. He's doing what he does. Boom, bam, bam. He hit the chick. We done. He still don't know her name. Don't care nothing about her. Comes home, takes a shower, and keep it moving. Pray to God you don't ever find anything else about it, right? Does it mean that he's not trustworthy? No, it means that he's a victim of circumstance. It's a circumstance that he put himself in, but nevertheless, he's a victim of circumstance, right? So please don't ever think that testing is about trust. It is about your health. It is about your well-being. And trust me, I have patients whose husbands have full-blown diseases and infections and they have nothing. So ladies, do not think, and men the same, do not think that because your testing is clean that your partner doesn't have anything. No, they need to go and get tested on their own, and they need to show you their stuff, and you need to show them yours. Point blank, period. Women have this thing, and I'm saying women, I'm not picking on you guys, but I see women all day. I don't know how men think, but well, I do, but not about this. Women have this thing about full disclosure. Oh, I gotta tell him this. I gotta full disclosure. Well, full disclosure on one side, because what y'all do is y'all tell all y'all business, and then you don't expect no information from him. That's not full disclosure. That's giving away your medical information. You haven't gotten anything to improve the situation or to better, like, what are we doing here? So full disclosure is just that. You give information, you get information. Got it? Okay. So that's one of the big things. Please see their STD testing. There's no way around it. Now, what I will say, I like to tell my patients to do a particular thing. We're going to talk about HIV prevention a little bit later on, but one thing that I am big on, baby, go to one of these stores, one of these like pharmacy convenience kind of stores like your Walgreens, CVS. I don't know if they carry them anywhere else. That's my ignorance. I just know Walgreens, you know, CVS. My fault, girl. That was my other line. Okay, so like I was saying about Walmart, Walgreens, CVS, to get the at-home HIV kit. So yes, they have one, girl. Yes. And they may have one for other STDs, but I'm not going to speak on it because I don't know how accurate it is. And so I'm always like, get tested. Don't play around with that at-home stuff. So anyway, but the at-home HIV kit, I believe it's like a little swab for your jaw. And then you drop a couple of drops on it. And if the person is HIV positive, it'll turn like blue. If I'm not mistaken, the results take about 20 minutes to come up. So if that's a killjoy for somebody, let it be a killjoy. That thing could potentially save your well-being. Okay. And so, you know, before we get started with the whole, hey, listen, we sitting in the living room, we Netflix and chill, go ahead and swab your jaw and drop. If something happened, cool. If nothing happened, cool. But at least I got the information. So that is also an option, you know, in a situation where you kind of want to be with somebody, they haven't gotten their testing yet, you know, you really shouldn't be. That is also an option. The at-home HIV kit, I think it's 2 tests in each kit, and it's like $40. So it'll be the best $40 you ever spent. Buy it, keep it up under your cabinet. You might not need it this week, but you might need it the next or after that too, okay? So that's just when it comes to testing, that is big for me. Make sure you're seeing it and make sure your tests are complete. Let me just tell you what I order when I order testing for my patients. When you come into the office, you're going to get hepatitis B, hepatitis C, syphilis, herpes, and I really only check for herpes 2, which is genital herpes, because herpes 1, like, you know, you get 10, 12-year-olds who have that, you know, 5-year-olds, even sometimes from like the daycare center or whatever. So herpes 1, I'm not really that big on, but hepatitis B, C, HIV, syphilis, and herpes. Those are the 5 blood tests. As far as vaginal testing or cultures, I check for gonorrhea, chlamydia, and trichomonas. Now, something to remember. In males, the trichomonas test is always going to be negative. I don't care. Don't squabble me in the comments. That trick is always going to be negative, okay? And I can only give you my logic behind it, which I will give you, but the trick is always negative. Understand, as women, we have our urinary tract, which is one hole, and then we have our vagina, which is under that, which is another hole, and that's kind of where our discharge and everything is separated. For males, they have one hole, right? Which we all know. And everything comes through that hole. Semen, urine, everything comes through that hole. So I think for the trichomonas, you only need this much to infect somebody, right? But you need this much maybe for it to pick up on a test. And I think oftentimes with so much, you know, coming through the urine, all the stuff and all the dilution, I think it might come down to this much. Now, it's enough to be infected, but not enough for the test to pick up, if that makes any sense. And generally, to boot, which makes it even worse, girl, males don't have any symptoms. So now you done picked up trick, right? Because trick smells a little bit like vaginitis. It's just a little bit more. I can tell the difference. I say, like, how do I explain it? Like, vaginitis is more, and not all vaginitis is fishy, by the way, but some vaginitis is fishy, and I say trick is more like dead crabby, if that makes any sense, like old crabs versus fish. So trick is a little different. It's not really noticeable to the normal nose. Some gynecologists don't even really notice a difference. I notice a difference with the trick, but it doesn't matter. The point is, you go, you get trick, and you telling this man, you gave me trick. First thing he gonna do is go get tested. First thing he gonna do, 1, he ain't got no symptoms. 2, his test gonna come back negative. So now you got somebody who has no symptoms and test is negative. So you ain't fitting to convince that man that he gave you trick or even that he has trick. And then the sad part is these urgent cares, emergency rooms, and some of these doctors, when they come back negative, they won't treat them. And so I'm like, whoa. Here's this. It's a sexually transmitted disease, right? So I don't care where it came from. I don't care whether he gave it to her, or gave it to him, whether he gave it to her or she gave it to him, or in between. No judgment. I don't care. If it's sexually transmitted, then the reality of the situation is the other person has it, right? So I don't care where it came from, but if this man is saying, hey, my female partner has trick, even if he tests negative, knowing that it's sexually transmitted, he got it. That don't make no sense. Like, treat him. It's only 4 pills. Some of y'all get caught up in that 2 pills a day for 7 days, but it's actually 4 pills. 2 grams off the rip, and it takes care of it. But the point is that, you know, let's be smart about this thing. Let's know where we sit. Let's know where we stand before we even get into a sexual relationship. So it ain't got to be no finger pointing. You gave this and I gave this and I had this, and how you know you didn't have it? No. What we're going to do is we're going to know off the rip from starting point who had what. Does that make sense? And it's a responsible thing to do, not just because you're outside, not just in a jump off situation, but it's a responsible thing to do. Now, I will always say to my patients, let me do 2 things. Let me prevent you from HIV and let me prevent you from pregnancy. Let me prevent that. Anything else I can fix, okay? But let's talk about pregnancy prevention. If you are in the particular age group, okay, where pregnancy is particularly a thing, we have to be worried about that. And please do understand that Plan B has a failure rate. So do not think that, oh, because I took a Plan B, that's just going to definitely take care of the problem. No, you understand the political climate that we're in. So most of these states, abortion is illegal. Here in the state of Georgia, baby, you better not get past that 6 weeks. Not 6 weeks in a day. Things are going to get problematic. And then a lot of times what y'all are seeing with, oh, she popped up at the hospital and they wouldn't perform her procedure and she died. So, and again, not that I'm excusing any physician, but I do want to help you guys understand how that goes. So a person comes to the hospital, oh, I took the abortion pill and now I'm bleeding, I won't stop bleeding. And so the abortion pill, unless it's a very, very, very early on, a lot of times doesn't complete the abortion. A lot of times due to heavy bleeding or you haven't passed all the tissue, you end up going to the ER. Well, now with all these laws and rules and all this stuff in place, so now you have an ER who, again, the doctor is an employee. Okay, so they have to defer to the rules of the hospital, risk management, legal, and the administrators at the hospital. They are at their beck and call. The doctors don't run this. Please don't think the doctors be running stuff, okay? So now we're in a situation of, all right, so the abortion was an elective abortion, which means you got it because you wanted to have an abortion. And now it's not complete. So what I'm doing, although it is saving your life, I'm completing an abortion, which is not legal, which the hospital does not agree with. So now this has to go up to the chain. Now the doctor really hits administration and say, hey, I have somebody here, blah, 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 blah. Now what the situation should be is, regardless as to what the person had done, they are in a situation that is life-threatening to them. And what we need to do is get them out of that life-threatening situation, deal with the particulars later. But again, that's from a common sense standpoint. That's from a physician standpoint. That's not from an administration standpoint. Administration and risk management does not want anybody to be able to look at this hospital and say, oh, they're going to start coming here because they know that we'll complete their abortions. They're going to start coming here because they know there'll be no questions asked, whether it's an abortion that they attempted, whether it's an abortion that they got a medical abortion and it wasn't completed. So we don't want to start this. So now we got to figure out the rule. All the while, this person is bleeding and having issues and having problems, right? And so the doctor can't do anything without administration saying, yes, go ahead and do it. Administration is waiting on risk management, and it just becomes a whole big boom, boom, boom. And we pray that the patient stays stable until it gets worked out. And sometimes that's not the case. So you don't want to find yourself in a position like that. And yes, the plan B has a failure rate, okay? So what are we going to do? And I always ask my patients, what is your sexual hygiene, right? So, and that's something I made up. I'm real proud of it. But it's like, what is your sexual hygiene? So I'm like, okay, you have sex with somebody. Y'all put on a condom. And y'all know I only condone B condoms, B, the letter B. B condoms are there at I ain't know about Walmart, but they're at Walmart. I think they're at Walgreens. I'm not exactly sure, but the letter B. And they may even have a website where you can order directly from. I pray they do. But it's B condoms. It's a Black-owned company, and the lubricant that's on the condom does not cause irritation to the vagina, does not cause itching, burning, none of those things, because the lubricant that's on most other condoms causes itching, burning, swelling of the vagina. And if the condom breaks, it actually makes it easier for you to contract HIV. Boom. Yes, that part. So I always ask, what is your sexual hygiene? So it's like, okay, you put on a condom. Great. I love you for that. Condom broke. And you don't know, you didn't see the person's statuses for any STDs, including HIV. So then where are we? What are we going to do? And they're always like, okay, I'm going to stop, I'm going to get in the shower, and I'm going to take a plan B. And I'm like, okay, what else? And then people are stumped. Okay, so get a pen. Get a pen, sis. Because if you don't remember this, I want you to keep it on a little piece of paper, a little card, whatever, fold it up and put it into your wallet. So get a pen. And brothers, if you're watching this, get a pen. Because you need to make sure these women are doing this, and you need to be doing it as well. So let's get a pen. Step one. If we are having, we should be, I pray we're having protected intercourse. We're having protected intercourse. The condom comes off or the condom breaks. However you want to deal with that. The first thing we want to do, let's go ahead and stop. Okay. If we don't know the person's status, and if we didn't do an at-home HIV test, and if they're willing to do one, go ahead on and do the at-home HIV test. Okay. Just to give yourself a little bit of reassurance while you at the Walgreens or the Dwayne Reed or the wherever it is that you live, go ahead on and pick up a plan B. Okay, so we're going to get our plan B as early as we possibly can. We're going to do some HIV testing after we shower and do all the things. And then what I want you to do, and it's supposed to be 72 hours, but the earlier you do this next step is pivotal. The earlier you do this, the better off you will be. Okay, what I then want you to do is either find your nearest ER, and sometimes they don't even know. Find your nearest HIV prevention place, PrEP clinic, your nearest ER, your nearest health department. Find them, even if it's on a weekend. If it's like on a Friday or Saturday, you have until, Monday morning, but please do not exceed that Monday. Do not exceed 72 hours. I tell my patients 24 to 48. The sooner, the better. I want you to get a pill. It's called PrEP, post-exposure prophylaxis. It's 1 pill a day, okay? You take this 1 pill a day for 30 days, and it will prevent you from getting HIV at the rate of 98+%, okay? So this could really mean the difference in you becoming positive and you staying negative. After 3 days, if you have been exposed to HIV, that HIV will now start making copies and replicating in your body after 72 hours. So after 72 hours, you are now positive. If that person was positive and it starts replicating in your body, it only takes 72 hours. So we want to get that medication on board as soon as we can. So I say if you're in a situation where the condom breaks, the first thing we want to do is stop. We want to get everything out of the vagina. We want to get into the shower. We want to go to the drugstore. We want to get a plan B, and we want to get an at-home HIV kit. And then that day, that night, the next day, you want to work on finding somewhere that will prescribe you and give you post-exposure prophylaxis. And it's just 30 pills. It's 1 a day for 30 days. And it will provide you 98% protection from converting over to HIV if you have been exposed. Now, please don't feel like, oh, his test was negative on the at-home kit, or her test was negative and the at-home kit, so I don't need to take the PrEP. That is not true. Because understand that blood testing is a 6-week, or testing any period is a 6-week delay. Right? So the reality is that whatever testing you see somebody, that is what their blood work looked like 6 weeks ago. Even if the test was done 2 days ago, oh baby, that is what their test looked like 6 weeks ago. So even if you get a negative or all clear, it still doesn't mean it's all clear up until today. It's all clear up until 6 weeks ago. And that's the best we can actually do. So even if that at-home test is saying negative, take a little deep breath. They ain't got a long history of having HIV. But please don't think that you don't be assured that they're HIV negative because that test is negative, okay? You hear me? I hope I was very clear in that, because that is my routine for, if you have an accident out here in these streets, okay? And when I say streets, I mean sexual streets, not actual streets, all right? So that is very, very important. Now, let's get back to the whole pregnancy prevention component of it. If pregnancy is not what we want, we need to start thinking about early on, like, how are we going to prevent this? Now, I'm not going to go into every method of birth control because, girl, that's a whole nother video. But we have some people like, I don't want no hormones in me. That's an IUD. Get an IUD. Get one, sis. It ain't going to go nowhere. If it's put in properly, you need the proper provider, because see what y'all going to do is y'all pay $500 for some hair. Then y'all pay another $150 to have this hair glued down. Then y'all pay another $200 for lashes. Then you pay another $150, $200 for nails. Okay, lest we get into the teeth. Lest we get into y'all walk around with 2 and 3 phones. But then when you got to pay $100, $150, $200 to see a good doctor, you want to argue. Make it make sense. But anyway, so if you have somebody who knows what they're doing and putting your IUD in and confirming that you have proper placement, did you realize that even when you have the Mirena, the Skyla, the Kylena, the Liletta, even when you have the IUD with the hormone actually stays on the inside of your womb. There is nothing circulating through your bloodstream. And that is why we preserve like the IUD for like people with blood clots, heart disease, when they got medical problems, girl, that IUD is what we run to, because there's no hormones circulating in your bloodstream. So if you're somebody who like, I want the benefits of birth control, I just don't want the hormones, the IUD is going to be for you. It's going to be for you, sis. And no, it doesn't have to be. I want the non-hormonal. Why? The only thing the non-hormonal does is it makes your periods longer. It makes them come every month, and it's just really of no benefit to you. Now, you get some people who culturally, they have been trained, have your period every month. That's how you get clinked out. That ain't true, but I'm not going through that in this video either. So the point is that if you just are afraid of like the hormonal, or you, whatever the case may be, an IUD is the thing that you want to do. If you cool with taking a pill every day, put it next to your toothpaste, brush your teeth, pop your pill, and keep it moving, okay? But pregnancy prevention is something we definitely don't want to leave to the, I don't think it's going to happen to me. I ain't got pregnant yet. Last words of a non-pregnant woman. It ain't happened yet. Don't do that. Don't do that at all. Okay. So let's not take it to chance. Let's have some responsibility, because, you know, a lot of times I think that, and these are things that need to be talked about, guys. Y'all need to be like, before you just go raw dogging somebody, before you just be like, ooh, she trying to give it up. Like, you know, don't be a loser. Actually say, so you want a pill? Because rather than just ghosting somebody and not taking care of your kid and worsening the family structure that we have even worse than it already is, why don't you just open your mouth and ask a question and be a grown man about it and put a condom on, or be like, no, sis, I'm not into that. I don't want no kids. I'm not ready for no kids. I don't even know you like that. Like, grow up and have some responsibility for your penis. How about that? Just a thought. So yes, but we need to deal with that out front and just straight up, you know, deal with it before it becomes a problem. I'm all about prevention. Let's be proactive and not reactive. How about that? So depending on where you want to be in your life, then, and don't, you know, women are good for being like, well, I mean, if I get pregnant, I'm okay with that. But is he okay with that? Is he okay with that? Because then he don't want a relationship, you mad. He don't want to take care of the kids, you mad. He don't want no parts in the pregnancy, you mad. But you, so it was your plan. You decided on this, and then when he didn't agree, he the problem. No, sis, we're not doing none of that. No, we not. We're not doing any of that. So please be as protective as you can be. Mistakes happen, situations happen. I get it. Again, there's no judgment here. But do all that you can do to protect yourself so that you don't end up in a situation you don't want to be in. Got it? And that's both of y'all, male and female, and in betwixt and in between. Okay. Now, as far as STD prevention is concerned, honey, again, make sure you're getting your testing. You get a vaginal culture done. Dudes can actually go and pee in a cup. Like, I think that at some point, maybe like in the 70s or whatever, and it was like in the 70s, 80s, not even 70s, like 80s, you'd have to go, they put a Q-tip in the tip of their penis to test them for certain stuff. And somebody done went back to the village, baby, and done told these men that that's how the testing goes. They will not show up. They will not get tested. They don't want no smoke with any STD testing. They will not do it. But it's not like that anymore. All they have, theirs is actually easier than ours. All they actually have to do is have blood drawn and piss in a cup, and we got all the information that we need, minus the trick. Okay. Now for us, obviously we come in, you get a vaginal swab, and they check for me, like I said, I'm going to check for all the vaginitis. I'm going to check for all the yeast. I'm going to check for all the cervical infections, and I check gonorrhea, chlamydia, and trichomonas on top of everything we already talked about. Now, the best way to prevent any STD is condom use, like condom use, sis. Because I always say to my patients, and again, I will tell them in a minute, no judgment, sis, but what has this man done so magical? And the D might be good. The D might be good. But what has this man done that's so magical that you would allow him to expose you to cervical cancer, because that's HPV, to cervical cancer, HIV, all the STDs, and pregnancy? Like, what has he done so magical that makes you take all that risks? So if you're a business major, if you're in business, if you're an entrepreneur, that's a bad business deal, isn't it? Because you've taken all the risks. He's taken all the benefits. Because understand, for the most part, and like I tell women, as long as he has an erect penis, it might feel a little bit different, condom, no condom, whatever it is that you into. But for males, it is 100% difference in sex with a condom versus no condom. So the reality is this person has gotten all the benefit. You've taken all the risk. And that's okay if that's something that you into. But tell me what he's done that's so magical that would make you do something like that. and then everybody sits and looks at the floor. And I don't shame anybody, because it's not about shame, it's about you thinking. And so that's where I am with this. So at the end of the day, especially my outside people, baby, if he ain't got no condom, make sure you have one, and be like, bro, I need you to get some B condoms. You don't know where to get them from? Run me $10, $15 and I'll get them for you, because I do not want you to get up and leave and now my whole vagina is swollen, it's aching, I got vaginitis, all the things. Okay, so we're not doing that, because you're not going to pay for the doctor's visit for me to get treated and tested for this vaginitis. So let's go ahead on and make sure we got these B condoms on deck, please and thank you. Another point when it comes to condoms, please, 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 for the love of Jesus, Mary and Joseph, do not buy lambskin condoms. Please, 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 please. Now, why is that? Because lambskin, these folk ain't lie to you, is skin. It's the skin of a lamb. So if you stop and think about that, skin has pores, right? Like, and pores are a fancy way of saying holes. Okay, so the pores in the lambskin condoms, the size of the pores, so the size might be like that, is larger than the size of the HIV virus, which might be like that, right? So if you stop and think about it, if you're wearing lambskin condoms, you can still contract HIV. Now, it will stop all the other STDs, the gonorrhea, chlamydia, and trichomonas. It will stop those STDs, but it will not stop HIV. So we're gonna put on a condom. How about we put on a condom that catch everything, not just certain things, like, and that catch the major things? How about that? Because it's giving, that's a waste of time. But do you? Again, we listen, we don't judge. Do you? But just a little word to the wise, okay? So condoms are going to prevent all that, okay? So I said what I said. And that is where we are as far as testing frequency is concerned. And this is the last thing that I want to touch on. Testing frequency. It varies. I am super anal. So I don't care what kind of relationship you're in. When my patients come in for annual exams, like once a year, because I'm a once a year pap or two, yes, that's me. I haven't let that go. All that 3-year, 5-year foolishness, it might be for somebody else. It's not for me. And we're not going to squabble in the comments. I said what I said. Now, when my patients come in, you know, if they consider themselves in a stable relationship, because, and we're going to talk about how I feel about risks too, but they're tested once a year, or whenever they come in and say, yeah, I feel like I need to be tested. I don't have any questions. You get tested. Period. Whenever you want to be tested, you're tested. But at least once a year. Now, if you're in a situation where you are maybe in a sexual situation with somebody who is not, quote, monogamous, and we'll talk about that because whoever knows, or it's very well known that this person has multiple partners, or you have multiple partners, or whatever the case may be. If the condom breaks, a bunch of people then are involved, then I would say that testing needs to be every 6 months. Okay. If it's even more than that, like if we have our sex workers or anything like that, I would say every 3 months, and in some situations monthly, depending on, you know, what your exact situation is. But for the standard, I'm outside and I'm having a good time, I would say every 6 months. And for something that's a little bit more laid back, it's going to be at least once a year. Now, you'll hear a lot of times, well, I'm not high risk, I'm not low risk. What's high risk? What's high risk? See, that's something that providers put on people, and it burns my ass. If I have to say it bluntly, it burns my ass. Because I don't believe in high risk, low risk. Risk is risk. Right? So I guess somebody would be low risk if they were married for 5, 10, 15 years. Really? So does it mean that she doesn't have a jump off? Does it mean that he doesn't have a jump off? Not at all. So what makes either one of them at any less risk? Because you don't know what people do. You know what you do. You don't know what anybody else does. So what makes them at any less risk than somebody who is honest about, yeah, I'm having sex with this person. Yeah, we put on a condom, but I know he has another partner somewhere, and I have another partner over here. So test me. Yeah, what makes one person any less risk than the other? I actually think that the person who's more honest about their sexual situation is at less risk, because they're not going to take as many chances, because they realize that, okay, that person for the streets, like I'm out here and they out here. So test me. And yes, he going to put on a condom, because versus the people who are in a long-term marriage and they're coming home and they're busting down raw and they're doing a thing, but you don't know what he's doing with his side piece, and he don't know what she doing with her side piece, or whatever the case may be. So I'm not somebody who actually believes in high risk versus low risk. Now, and in situations where we have our sex workers, who, you know, may do it for a living or may find themselves in certain situations. Not that I find that any higher risk than anything or anybody else, but the reality is by sheer volume, it doesn't make them at higher risk, but it gives more opportunities for more things to brew or fester or develop because of the volume, but not because of their particular lifestyle. Because like I said, honey, you could be married to Herbert, because it'll always be the nerdy ones, so no offense, but you could be married to Herbert and Herbert got five of them, 1, 2, 3, 4, 5. So it's volume. When it comes to sex workers and things like that, not because they're sex workers. And I think that when you go to a doctor's office, a lot of times like, oh, Miss such and such, they've been married for such and such. And one of my colleagues said this one time, oh, I'm going to change labs because such and such came back with an STD. And I know her husband love her dirty draws. He would never cheat on her. So it got to be a lab error. I said, I know you damn lying. I said, so wait. I said, her pap was normal. Yes. All of her blood stuff was normal. Yes. I said everything else was normal except this one STD. She said, yes. I said, so all of that normal stuff is accurate, right? But the abnormal one is wrong. Girl, make it make sense. Girl, you don't know what that man do in his private life. You don't know what they got going on at the house. You know what they show you at this doctor's office. Girl, please. So a lot of what happens not being accurately tested, you know, a lot of that is based on provider prejudices and ignorances. So if you know you want to be tested for something, you know you desire to be tested for something, somebody's opinion on what you should or should not be tested on, that is their opinion. Okay, and let them keep that opinion for themselves. And you go in there, yeah, I hear you, but I want this, that, and the third. Now, one final thing I want to talk to you guys about, and this is maybe you're not outside, right? Or maybe your partner, but your partner may have a high risk lifestyle. What does that mean? You may be with a rapper. You may be with a professional player. You may be with somebody who has a very high net worth. Okay, and we all know where the money is, the hose is. It just is what it is. You can call it what you want, say what you want. Where the money is, the hose is. And sometimes they may not make great decisions. The decisions they make are the decisions that they make. You may even know your partner is in a particular space, but you're like, listen. And I've had somebody say this to me, ma'am, I live in a $750,000 house. I drive a $100,000 car. My kid goes to a $15,000 kindergarten. And I have a $10,000 a month clothing allowance. Tell this man to put on a condom, what? And I know he in outside. Okay, I'm human just like anybody. I say, yeah, damn girl, you can't tell him to put on no damn condom. Like, I mean, yeah, you don't want to do that. Don't mess up your money now. But what I did say was, but I can still help you. And so what we talked about and what I educated her on was PrEP. And I said, you know, there's two different types of PrEP, and PrEP is pre-exposure prophylaxis. And what this is if you feel like you may be at any risk, and I have to leave this up to you, not my perception, up to you. But I say any person who's having sex with another person is theoretically at risk. And we're going to wrap it up after this, y'all, because I've been talking a lot. So, but if you're at any risk, there are two different methods. We can do a pill for you, and that's one pill every day like a vitamin. One pill every day like a vitamin, and it will prevent you, again, with that 98.3% prevention of contracting HIV, right? But you get some people who are like, I don't want to do no pill, you know, I don't, you know, whatever the case may be, I don't want to be attached to a pill every day, blah, 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 la, 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 la. Okay, good. We have a shot now. So the shot is called Apritude. I love Apritude. You know, full disclosure, they have not sponsored my video. They have not sponsored my video, but I will be speaking for the company because I believe in it that much. And any patient who knows I talk about Apritude at the office. And it's an injection. It's every 2 months. Every 2 months you come in for your injection. Okay. And that is a 99 point, I think it's like 99.2 or 3% prevention of getting HIV. Okay, so you come in, you repeat your HIV testing, because in order to be on HIV prevention, you have to be HIV negative. So if somebody says to you, I'm on PrEP, don't get scared of that. Be like, okay, that's what's up. And males and females can get this, straight, gay, in between, in betwixt, it don't matter, 8 to 80, cripple or crazy. If you're a human being having sex with another human being, you can get PrEP. Okay, so I definitely recommend it. It's called Apritude, APRETUDE. Ask your provider about it. If they don't know, go somewhere in your city where they know how to prescribe PrEP and PEP. Develop a relationship with them and, rock out with that, okay? So that is the most important thing, prevention. So again, if I can prevent HIV, I can prevent pregnancy. I done told y'all how to prevent these STDs. I done told y'all, how to have responsible relationships. Make sure y'all are seeing people's testing and make sure they are showing you theirs and you're showing them yours. And then we got these 8 at-home kits, and just knowing that nothing is 100%. Go out there, have fun, do you. And when you need help, when you need guidance, go and get it. But outside of that, let nobody judge you. I hope this video does somebody well. Please share it as many times as you feel is absolutely possible, with as many people as you feel is absolutely possible. Let's get control of this thing, because when it comes to HIV, y'all know Atlanta is number 3. And as Black women, we're 12% of the population, but we're 70% of the new HIV cases. Those numbers are not funny and they ain't cute. And so nobody's coming to save us, as you probably well see, and we have to save ourselves. So please get this information out and use it as you see fit. Have a good one, and thanks for listening, y'all.